Okay, we're going to be drawing an IM injection today, and it is Toradol for Jonah Dinerman. So it's 15 milligrams, and the bottle says 30, so I will be drawing 0.5 ml. So I'm going to do hand hygiene. I have all my supplies with me. I saw that the patient did not have any allergies. And he is due for it now, or in about 5 minutes. Okay, so my syringe and the needle. I'm going to be doing a deltoid injection, so I want about 1 inch to 1.5 inch needle. So set that down for a second while I clean the top of the Toradol, that's correct. Okay, I'm gonna pull this straight off. Set this here so I can do a single-handed scoop when I recap before I take it to the patient. It's trying to roll off the table. Okay. Oh, before I do that, I need to make a vacuum so I can add pressure to the container to help with drawing it out. I like to draw a little more so I can push the air out. I need 0.5. Okay. And that's 0.5, and it's of the Ketorolac or the Toradol. Down. I'm gonna not turn my back to the medication. I'm gonna throw this away in my container. My shirts container is there. I'm doing hand hygiene again. So this is a pain med, and considerations is the patient shouldn't have it consecutively for more than 5 days, and the safe dose is for maximum effect 15 milligrams every 6 hours, but no more than 60 milligrams in a day. So I'm going to go see our patient. Good. Sit. Hi, Mr. Dinerman. I'm going to be giving you your injection, so I'm going to do some hand hygiene before I go in. And then I'm gonna can you give me your name and date of birth? So Jonah Dinerman, and that checks out. And can you give me your date of birth? Okay, so that's my right patient. Okay, I'm just gonna scan your name here real quick. It's kind of tangled in this. Okay. Oh, come on. Having some technical difficulties here, just kind of maybe gotta reset it, of course. Okay, go back to my MAR, Ketorolac. patient. I'm just going to scan your code here. Oh, come on. Okay, there we go. Sorry, that took a second there. So it is my right patient. And then I am doing the Toradol, so do my last check, 30 milligrams. He's taking 15. So I'm going to scan my med. It's not wanting to work today. Okay, and that is the right med. I'm just going to do some, well, it's my 6 rights, so it's the right dose, the right route, the right time for the right reason, which is for pain, and right patient. I think that's all 6. I think I named all 6. Okay. Hand hygiene. Usually there's, closer gloves, but I'm going to grab my pair without turning my back to my med. Okay. So we're going to get this injection to your deltoid today, Mr. Dinerman. And this is for pain. So it takes about 30 minutes for this to kick in. So here, you in a comfortable position? Okay. About there, and maybe just lift you up a little. There you go. Is that comfortable enough? Okay. Okay, just going to expose your arm. I'm going to find the acromion process and do about 3 fingers down for the triangle. Then I'm going to take my alcohol prep. Oh, do you have any allergies that I need to know of? I would have done this before now, but kind of spaced it. No? Okay. And he's not on any other NSAIDs at the moment that could interact with the Toradol. So I'm going to do the Z-track. I'm going to uncap first. Kind of a mess today. Okay, the Z-track, so pull to the side and go 90 degrees. Okay, I'm going to do this now, Mr. Dinerman. 1, 2, 3. Okay, and while keeping Z-track, do that. I'm going to eject it. And then, okay. And I'm going to find my safety. Put it in the sharps. Forgot to apply this when I pulled the needle, so I'm going to do that. Nothing came out, so sometimes I would do a Band-Aid if it does. Okay, you feeling okay? Yes? Okay. Dispose of my stuff. So I'll be back in about 15 minutes. Make sure you're okay, no reactions. And then it should have peak effectiveness at about 2 to 4 hours. So I'm going to go document while that kicks in. Here's your call light, water. And you want to go down? Okay, we'll go down a little. Okay. Okay, hit the call light if you're feeling any side effects. More than a stomach ache or a headache. If there's any shortness of breath or chest pain, let me know immediately. And we'll be back. Okay. I'm going to go take my medication back to the med room. In an actual hospital, they'd have an actual med room I could do this in. So I did right patient, dose, route, time. And I completed my 3 checks. We checked his birth date. We did it in his right deltoid. Okay. And it was administered. Okay, that's locked up, and I'll go back and check in on him, and then after that check, I'll come back in again in about 2 hours or before that if he calls.